After months of giving COVID vaccines and years of flu shots, pharmacies across Ontario are asking the province to let them also do routine immunizations, all while health officials say they have seen the largest decline in routine vaccinations in years.
It's by far the biggest decline in the world. By far.
Dr. Jiahu is a family physician. He says the number of people requesting routine vaccines has dropped substantially.
Because normally vaccination rates are pretty stable. It's not like 1 year, 90% of people get the measles vaccine, and the next year it's like 85.
Dr. Hu attributes much of the decline to the pandemic, with many people avoiding doctors' offices and schools being closed, stopping in-school vaccination programs for students.
We really want to at least get back to the rates of uptake we were before the pandemic, because we don't want to see things like measles outbreaks and people not getting HPV and getting cervical cancer down the line.
A survey commissioned by the Neighbourhood Pharmacy Association of Canada indicates that 1 in 4 adults have missed a routine vaccination. Of those people, 26% say they do not want to visit a family doctor or public health office during COVID, with 7 in 10 also citing accessibility issues. The data also suggests up to 35% of children may have also missed a critical routine vaccine.
Those delays or missed vaccinations could have been avoided by improved access to healthcare providers who administered the vaccines. So pharmacies are able to do this, and they're trained to do it, and they're able to take on that responsibility. The challenge still, however, is having access to the publicly funded vaccine.
Right now, if a patient wants to receive a vaccine at a pharmacy, they have to pay out of pocket. Sandra Hanna, who's also a pharmacist, says at times that could cost hundreds of dollars.
That is still the biggest barrier for us as pharmacy to be able to really play a significant role in helping to catch up on public health vaccinations.
Coming up with novel ways to, restore routine care, like having pharmacies give these vaccines, would be a great idea. And I think we do need to sort of remobilize the healthcare system to deal with things that aren't COVID. And given the current state of burnout, you just want to engage more resourcing if you can, and that'll be critical to solving this issue.
Health experts fear because of this, preventable diseases will spread at a faster rate. And we also reached out to the Ministry of Health but did not receive a response by deadline.